Well, if you or someone you know suffers from osteoarthritis, then you know how painful it can be. But our next guest, you know what? He says he can help you. Dr. Rainer Kremer from Catalyst Pain Solutions is here to tell us it's about a non-steroidal treatment. It's an option for you, and you know what? It could get you back on track. How does this work, Dr. Kremer?
Well, when you look at the integrity of here's an example of a knee joint. Osteoarthritis.
This one right here.
Yep, normal knee joint.
This is a good knee joint?
Good knee joint. And if here we look at kind of a progression, the blue that you're seeing is normal cartilage, and then loss of cartilage to where you have pretty severe osteoarthritis. What osteoarthritis is the loss of the cartilaginous cushion and a breakdown. When that happens, you go from a smooth surface and being flexible, and as inflammation takes place in the joint and as you lose cartilage, there's stiffness and there's pain. And that takes place in the spine, in the neck, in the low back, hips, knees, shoulders, in all your joints.
Okay, you're showing us knees now, but like you said, it could happen anywhere. Is that when you said you gave us this big long word here, does that really mean bone on bone?
It means bone on bone. When you've lost the cartilage,
that's the cushion.
The cushion is gone. And the common treatment is to take oral nonsteroidals, ibuprofen, Aleve. Kenny Easley was a football player for the Seattle Seahawks, and he was taking 8 to 16 ibuprofens a day, wound up with chronic kidney disease because those nonsteroidal drugs wind up shutting down the blood supply to the kidney. So you don't want to be on long-term therapy, oral therapy.
So what do you guys do? Catalyst Pain Center, somebody comes in, they have osteoarthritis. At any stage, what's your treatment?
Well, you want to reduce the focal inflammation of the joint and the surrounding tissue. So you want to deliver very intentionally and very focused where the area of injury is, and use either a low-dose steroid or a non-steroidal medication that is local to the area of damage.
Okay, so when somebody comes in, and again, we're referring to knees, you treat all the joints.
That's right. Cervical spine, lumbar spine, low back pain is very, very common. And there are a lot of things you can naturally do for this at home. Physical therapy, movement, walking, that you can take glucosamine, you can take turmeric. We also have a pH management product. You want to reduce inflammation with diet. All these things are very helpful.
And shouldn't you be doing those things anyway?
You should be. I mean, because it's really about reducing inflammation.
Right.
Because if inflammation stays in an area long-term, calcium salts go into the joint to help support the joint, and you wind up with osteoarthritis.
So how does somebody, well, first of all, is it something that just appears? Is this a genetic? Are you predisposition for this? Do you acquire it? How do you get it?
Great question. It's cumulative trauma. The orthopedists have done research in this area. There is a genetic component, and it kind of loads the gun, if you will, but what pulls the trigger on the gun is repetitive micro traumas. Pounding, stretching, overutilizing a particular joint beyond what it's normally comfortable with. And what happens is you lose that fine cushion that wears and tears, that inflammatory process and that degenerative process. We can help stop that process.
And we're not talking about surgery.
No.
That's what I think is the key here.
Yeah, this is a minimally invasive procedure directed to the area of damage to help that area reduce its inflammatory load and improve and give it an opportunity to heal naturally.
All right, and that's what we all want. We want to avoid the knife, and we want to just do what we love to do. Even if it's just walking, if you can't walk, then you got a problem.
Absolutely.
All right, Dr. Kremer, you're amazing. Thank you, as always. I want to tell you about very important information here. It is the next generation of medicine. It's CatalystPainSolutions.com. Here is the number to call. Look them up. You can make your appointment, find out how they can help you. 480-821-PAIN or 480-821-7246.